Now, if we just all hung upside down and had the blood running the other way, we'd never have a problem. If we just stayed in a chair in a recliner and kept our feet up all day, we'd never have a problem. So what can you do about them? Well, in the meantime, you can keep your legs elevated. The next best thing is you can put some support hose on. What do support hose do? They limit the amount of fluid that can push you out into your tissue. Without getting into weird doctor talk, they kind of overcome the oncotic pressure of the outflowing fluid. They also push those little valves back together so you don't get the swelling. Problem is we live in Florida, and the 7 patients I saw in my office today that needed hose, not one of them got them. Why? Because it's 95 degrees outside. The other 3 that didn't get them were, well, I have arthritis and I can't put them on. So between having to put them on, their uncomfort, and the 3 young women were like, well, I won't look cute. So, I mean, there's various reasons for why people don't want to wear hose. So then what do? You're not cute, you can't put them on, it's too hot. I get everything under the sun for why we're not going to wear a hose. Well, what else can we do? And a lot of patients are looking for, doctor, can you do something? Can you fix something? And as surgeons, we kind of like to get our hands on something and fix things. That's probably why we, and my partner, Dr. Wright in the back's here too, the younger version of me. It's why we like to get our hands on things to fix things. And there are some things we can fix here. What can we do now? And what's come out in the last, I'd say a little bit over 5 years, when we found these bad veins, really all we could do is take you to the hospital, put you to sleep. When people say they had their veins stripped, we'd put a large poker from your ankle to your groin and we'd rip the whole vein out. Well, that sounds like a great idea, right? And in the old days, people would be in the hospital 3 to 5 days. When I was at the VA hospital, veterans would literally be in the hospital for a whole week. They come in on a Monday, we do their surgery on a Tuesday, they go home on Friday, an entire week from varicose vein stripping. Well, fortunately, I can't remember the last time I've ever done a varicose vein stripping. We don't do that anymore. We don't take patients to the hospital anymore. They're not put to sleep, or they don't need general anesthesia anymore. Everything we do now is completely done in our office. The more complicated vein problems that we find that require open surgery, we bring them over to St. Joe's and we fix those. So we have to decide, are we at this level or is it something complicated we have to bring to the hospital? The stripping thing is over with. We really don't do that anymore. Every one of these patients in here we treated with what's come out now, it's called endovascular, inside of your vein, laser ablation. Ablation means to get rid of, to destroy it. And so now when we find these bad veins, we can literally just in an office setting, no cuts, no sutures, no nothing, put a tiny laser in and fix some of these veins. What we do is we bring the patient back into our ultrasound room. We have a sterile environment with an ultrasound scanner where we find the vein that we found it was bad, and the vein up there is in blue, and that's where we know where we can put the laser in. After we do that, we put the laser that we have in our practice into the vein. The laser heats up to about 1800 degrees, and after we've numbed that area with 1 or 2 little bee stings, the laser starts to close this vein from the inside. Okay, so instead of us having to cut these veins out or do anything, it literally melts the vein and just turns it into some scar tissue. And if you look over to your left, that's a heated probe before we turn on, and to your right after it's through. And the vein is completely obliterated at that time and your body absorbs it. So now it's basically like a bucket with a hole in the bottom. If the bucket's going from your feet up to your heart, it had a big hole in it that was leaking down. Well, what have we done now? We've taken that laser and we've closed that one big hole off. So now that fluid that's running the wrong way through that bucket is gone. The blood reroutes itself into good veins and returns itself to the heart. So you don't have the pressure, the aches, the pains, the swelling. A lot of people say, well, what about if I need this vein for heart surgery, which is a great question. People come in very knowledgeable about things like this. If that vein's needed for heart surgery, it's a vein that's no good. It's already been dilated in varicose. We can't use it for bypass. We use these veins for bypass all the time. In our own practice, we can't use that. There's multiple other veins that you can use from your arms or arteries from your arms and your chest that you can use in lieu of that. So that's usually not a concern. As a related thing, and it's usually in combination with, if you have very large varicoses, we have a very small micropuncture needle where some of the larger varicoses, we can actually make a puncture and with the hook remove some of the veins at the same time. So any of the bulging veins you see are gone too. No cuts, no sutures, really no pain. And it sounds and looks bad, but you're walking in and out of the office in less than an hour. Walking in, walking out. No problem, back to your normal activities. So it really is something that that's really replaced conventional surgery. As far as the spider veins are concerned, since we're all Floridians and we're familiar with the Gulf oil leak, I kind of like to use that analogy. When you have the Gulf oil leak, that's where all the fluid and blood's leaking from deep down. When you see the oil on the top of the surface of the water, those are the spider veins. That's where the pressure and the blood has leaked from the leak down deep and it's gotten up to the surface. That's what spider veins are. They're pressure from the deep system that's pushed all the way out into the tissue at the top. Well, once we go down and cap that leak, just like they did with the leaking oil, it's not leaking anymore, but the oil's still floating around on the surface. So now there's no other source for it to come up. We can go in and with a small needle, about the size of an acupuncture needle, it's got even probably a less than a 50-50 chance of actually even touching a nerve. The needle is actually that small compared to the distribution of nerve fibers in your skin. We can inject those veins and draw those up. And a point I'd like to make about the spider veins is, oh, I don't want to have that done. It's just cosmetic. I don't care about how it looks. I don't really think anybody believes that when they say I don't care how it looks, but pretend they really do. The problem with the spider veins and the telangiectasias is these are really what are intertwined around your skin nerves. And the achy, creepy, crawly things, restless leg syndrome, I really feel that that's got a big part of it is the spider telangiectasias in your skin. They're wrapped around these nerves and they're bulging out, so the nerves that are intertwined are all getting pushed on constantly. So that achy, creepy, crawly feeling or restless leg syndrome you get, I really feel that once we've closed off the problem, we really should inject the spider veins. It's a simple procedure. Our nurse practitioners do it. They do hundreds of them a week. And then that really completes the job. And then you've had a good and thorough treatment. As far as the procedure highlights, I really want to just mention a couple things. When you come in and you need to get the laser ablation, say you needed to get that done, it's simple. It's less than 30 minutes. You walk in, you walk out. There's no general anesthesia. There's no cuts. It's covered by insurance. These are some of our patients after some of the procedures we've done in our office. And the thing to note really is that these are really pretty, most of the time people take the before and after pictures a year later to really get some healing. We try to get some early pictures to really give you an idea how fast you get results and how fast you feel better. I mean, this is just 6 weeks later on this patient. The tense, tight amount of skin, you can see the difference at the bottom of the ankle, the swelling at the bottom on the left side compared to the right side. The less fluid, the less vein, the less pressure. Same with this patient. There's a couple little bruises up at the top, but this is only a month after something we've done in the office that would have normally been huge surgery in the past. This is another younger lady who had a very painful mass in her calf. This is a lawyer that presented with a clot in her calf. We had to treat her months later, and then we finally removed it. And you can see the before and after results. Same with the spider veins. Some of these spider veins, after a treatment or two, there's a remarkable difference. Sometimes it takes 3 or 4 treatments. This was after 4 treatments, but you can see the remarkable difference in just a few treatments. Same with this one. I wanted to put this one in because it was dramatic for the fact that this was after 1 treatment. Some patients, the veins dry up and respond immediately. Some take 3 or 4 treatments later, but sometimes even after 1 treatment, you can have remarkable results. And even our nurse practitioner thinks she's amazing when she does some of these because that's a legit before and after picture of one of our patients. You can imagine how symptomatic this was. Okay, she didn't want to wear shorts, she didn't want to go to the beach. But she even said to us, I didn't realize how much my leg was hurting and bothering me and how much this was a problem until I came in because I didn't know how it looks, and now my leg feels tremendously better. So even people who thought it was cosmetic realized there was large symptomatic relief from this. I guess I'll finish up with, do you have vein disease? The problem with venous disease in your legs there's a lot of things that go on with your legs. It cause aches, pains, cramps, tenderness, night cramps, restless leg. And we have to ferret that out. And that's what we'll do. We'll tell you, do you have PAD? Do you have arterial blockage? Do you have venous insufficiency? Do you have arterial disease? It is a complicated topic, but if you have people in your family that have varicosities, you got a good chance of having it. If you've got spider veins, varicose veins, your legs are swollen, you got a good chance there's some type of a problem there. And it's something that needs to be taken a look at. If you're just sitting there and you're realizing, oh my gosh, this is me, which half the people in the audience are like, oh darn, I have all these symptoms, and they start getting paranoid. What can you do in the meantime? Before you go rushing off to the emergency room or our office, you can do a couple things. you can start getting into some little program where you know you're taking a walk or two a week. Because actually when you're walking, your calf muscle in your leg is pumping blood continuously out of your leg, and some of your lowest ambulatory venous pressures are actually when you're walking. So just a walk is tremendous. You can watch your weight. You can watch how much you're standing in one spot. You can try and elevate your legs during the day, and you can try to wear some type of light compression hose. You'll notice a difference. If you wear a compression hose and by the end of the night you're like, wow, my leg feels a lot better than it usually does, you might have some venous insufficiencies. If you have symptomatology of venous insufficiency, varicose veins, spider veins, it's not a cosmetic problem, it's a medical condition. They can lead to blood clots in your legs, they can lead to blood clots going to your lungs, they can lead to death, they can lead to ulceration. Needs to be at least looked at. Doesn't mean you need to have something done, but at least sit down with us or a board-certified vascular surgeon. I'm pretty big on the board certification thing. Somebody who knows what they're talking about, not somebody who went to some weekend course and is treating veins now to make a buck off you, but somebody who's been doing it for a while. Get some real information for yourself. And also realize how much of it's covered by your insurance. And when people start telling you this and that's not covered by your insurance, I start getting nervous. They're like, wow, I'm here in a doctor's office and all this stuff isn't covered. Usually means they're trying to get more than the insurance-based practice is going to give you.